This episode is brought to you by Banfield Pet Hospital and proudly sponsored by our friends at Zoetis, whose range of pet medicines, treatments, and diagnostics are designed to help you and your vet actively prevent diseases, manage skin conditions, treat infections, reduce pain, minimize anxiety, and more.
Your call has been forwarded to an automatic voice message system.
Hannah Shaw
Is not available. At the tone, please record your message.
Hi Hannah, Devin from Baltimore calling. My shepherd mix Scout has dry, flaky skin and scratches after walks. Friends suggested oatmeal baths and supplements, but I don't want to make it worse. What's safe to try at home, and when is it time to see the vet?
Have you ever caught your dog in a full-on scratching frenzy or caught your cat grooming one spot repeatedly and you're thinking to yourself, what is that all about? Itchy skin is one of the top reasons that animals visit the vet, and it can mean a lot of different things. It could be allergies, parasites, even stress. So when is an itch just an itch, and when is it time to call in the experts? To help us make sense of it all, today I am joined by Dr. Tova Pinsky. She's the Chief of Staff at Banfield Pet Hospital in Denver, Colorado. Dr. Tova is passionate about making high-quality medicine accessible for every animal, and she knows a ton about dermatology, nutrition, and preventive care. Dr. Tova, welcome to Not Just Fluff.
Thank you. I'm so happy to be here.
So tell me, you have a special interest in veterinary dermatology. What drew you to that area?
Yeah, it started even before I was a veterinarian. First and foremost, I am a pet lover. I'm an animal lover. I'm a pet owner, and the family dog that we had while I was in vet school had really bad chronic ear infections, and ear infections are painful. They're horrible. They're horrible, obviously, for our pets. They're horrible for us to watch. And our pet Jasper, he was also really naughty at the vet, so we had to sedate him, and it was a whole big deal every time he had an ear infection, and we couldn't figure out what the underlying cause was. And when I was going to vet school and I started my nutrition classes, we started learning about food allergies. And I came back home and I said, "Hey, mom and dad, I think Jasper might have a food allergy." And we switched his food and we put him on the diet that he needed, and he never got another ear infection again for the rest of his life. And he lived to 17 years old.
Well, I'm excited to talk about itchiness with you because I think all of us who care about animals have experienced this. And like you say, it is so distressing when an animal is just scratching themselves and you're like, what is going on here? I wanted to start with a very simple question, which is just what is itchiness? Like when an animal is having an itch, what is the science behind that sensation that's so uncomfortable for them?
Yeah, that's a great question. And the short answer is it's typically related to histamine release, which is a normal part of our immune system. But when we have itch, the immune system is acting not quite in the right way. And it can overreact to things that it shouldn't overreact to, which creates inflammation, histamine release, and releases that and causes that itch feeling.
When a cat or dog is having an itch, how can you tell the difference between like a normal itch and when there's a red flag we should be concerned about?
If we have hair loss, if they're scratching until they're bleeding, if there's red signs of infection, all of that is a major issue and has to be addressed.
This is something that a lot of cats and dogs face, and I assume that they have different things that you're looking for. So let's start with dogs. From your experience, what are some of the top things that you're looking for if a dog comes in who is itchy?
Yeah. The two main things that dogs are allergic to are either something in food or something in the environment. In saying that, I always like to rule out some of the easiest things first, which are flea allergies. Flea allergies are uncommon. Thankfully, we don't see a lot of fleas, but of course, if they are there or in the environment, that's the first thing to rule out because that's the easiest thing to address.
Aw. And are there certain like breeds of dogs or sizes of dogs or even like lifestyle or age that seem to be more prone to these like itchy allergies?
Labs tend to have environmental allergies, sometimes golden retrievers, but more so the Labrador retrievers. Poodles can also have environmental allergies. And then our really sweet, squishy faced breeds, our bulldogs, our French bulldogs, our pit bulls, they also have a higher predisposition to environmental allergies.
And for cats, is it different? Do you see different causes, or what are the most common issues you see causing itchiness?
They are different, and it's always important to remember that cats are not just small dogs. They are very, very different, and I know that you know that, caring for cats like you do. And so I would say that fleas are actually a bigger cause of allergies and itching in cats than they are in dogs. Not that it is the main cause for cats, but it definitely is more of a consideration in cats than it is in dogs. And then food allergies in cats, I would say, is the main trigger for a lot of kitties.
Itchiness can be very seasonal, I think. I adopted a Chihuahua, my beloved dog Birdie, and I adopted her in the winter last year and didn't have any signs of itchiness. And then all of a sudden, come spring, she's like pink and scratching herself under her little legs and, on her ears. And I was like, what in the world is going on? So I brought her in and we were able to do some testing. We determined, unfortunately, that she's allergic to like every tree in Southern California, which is where I live. So that felt very unavoidable, but good information to have. What are some of the most common environmental allergens?
In terms of allergens, I would say that it's primarily pollens, and then the changing of the seasons. As soon as spring comes and we have the bloom and the release of pollens, and that can be an issue. Fall can also be an issue when we're having falling of the leaves, the end stage of the flowering, and a lot more allergens in the air.
And I always wonder because we have two chihuahuas and our other chihuahua totally unaffected by these things. So, what causes this to affect one dog but not the other dog? Are they born with that? Do they have some event that triggers the allergy? Like, why does that happen?
Yeah, there definitely is a genetic component to it. And because allergies are so linked to a pet's immune system, there is also going to be an individual component to their allergies. In terms of a triggering event, it's not typically one single event, but as pets go through different seasons and become exposed to different allergens over time, they can become more allergic over time. The body's immune system doesn't recognize, oh, I see this pollen every spring, it's not an issue. It can actually make the immune system more overactive year over year, and the allergies can get worse over time.
I know that you mentioned food allergies as a top concern. What are some of the most common food allergens that you see? And are they different for dogs and for cats or similar?
Great question. They are a little bit different between dogs and cats, but the primary allergen for both species is a protein. So the top allergen in dogs is chicken, as well as associated poultry products, followed by beef is less common. And then we go down different proteins. Some pets can have allergies to grains, but that is far less common compared to protein allergies. And then allergies to something like fish is also uncommon.
Hmm. And what is it about those proteins that affects these animals that have the food allergies?
When the pet ingests those proteins, as they get absorbed through the GI tract, that triggers an allergic response in the pet. So it's actually really interesting. I would love to chat about hydrolyzed proteins. Can we get into
Yeah,
that for a
please.
moment? So, whenever I am exploring the potential for food allergies, we don't have any accurate blood tests, saliva tests, hair tests, anything like that. And so I don't want pet owners spending their money on that because those have not been shown to be valid. So the way we investigate for food allergies is through a diet trial where we feed the pet a very specific diet for usually about 12 weeks and see how the pet responds. And there are two options for feeding those diets. One of them is to find something in the non prescription area of the pet store, something that has, say, salmon as the only ingredient. The key there is salmon may be the first ingredient, but you have to look at the rest of the ingredient list to make sure that there aren't fillers with chicken and other things that could be allergens. So it makes it a little bit more difficult. The hydrolyzed protein diets are the make up the most of the prescription food allergy diets, and I like to explain it like Lego. Um, in a chicken protein, if we think about the little Lego pieces, we put them together and that creates a chicken. And when a pet ingests that protein and it gets absorbed through the GI tract, the body says, I recognize that. That's chicken. In the hydrolyzed protein diets, it still may be chicken, but what happens is that protein gets broken down into its individual amino acids. So you're taking apart the Lego pieces into the individual blocks. Then when the body ingests it, it's just noticing individual blocks and it can't recognize that's chicken. The body then doesn't trigger that allergic response when the proteins are broken down.
And now I want to hop to talking about parasites a little bit because you did mention fleas as one of the first things that you rule out. And I think sometimes people imagine that fleas are not an issue for their animal because they didn't see a flea. I am always telling people, a lot of the time we don't see the flea. We might see the evidence of the flea. Can you talk a bit about that? Like, how can people figure out, even at home, if fleas might be a concern?
Absolutely. And you're exactly right. Typically, we think that if we don't see them, they're not there. But unfortunately, for fleas, that is not the case. Fleas, if we think about a pet that has fleas, something like 95% of the population of fleas is actually in the environment itself, not on the pet. Fleas also really don't like sunlight. And so, if you open up the windows and you think, all right, I'm going to search through my pet's bed for fleas, you probably aren't going to find them because they go away. They run away from the sunlight. Um, I recommend that all pets be on a flea prevention medication just because it is such a difficult thing to experience. Even if your pet doesn't have a flea allergy, nobody wants fleas in their house. Like that is just not fun for anybody. So I recommend having all pets on flea protection so that we can just rule that out and not have to worry about it.
I imagine there are other parasites that can cause itching as well. Can you talk about some of the other parasites or mites that exist in the environment that could be causing itching?
Absolutely, yes, yeah. Ringworm sometimes can cause itching, and so it's always an important thing when pet owners come into the clinic with concerns for their pets is anybody else in the family having skin issues? Because that can be a really important piece of information. Um, and then there are two mites that pets commonly get, or not commonly, but two mite species that pets can get. One of them is called Demodex. The other one is called Sarcoptes scabiei, which we know best as scabies. And Demodex by itself does not typically cause itchiness, and that can be a normal finding in the skin. So there's a lot of consideration that goes into our lab testing and lab results in evaluating whether a mite is causing an issue. But Sarcoptes scabiei, or the scabies mite, is always an issue, and they are always really itchy. These pets are just 10 out of 10 on the itch scale. They can't sleep. They're tearing themselves to pieces. They often are bleeding. They've ripped out all of their hair. It is just, it's absolutely heartbreaking. And this can be transmitted to humans as well. So that's a major health concern for the entire family.
I actually have a personal story about this. My introduction to sarcoptic mange was an unexpected one. Years and years ago, I was in Alabama, just like driving through a little rural area, and I found a dog with no fur at all. And she was in horrible condition, like really thin. I scooped her up right away, like put her in my arms, brought her to the vet immediately, and worked with her, and I was able to get her. It's a happy ending where she ended up getting all of her fur back, and she was glorious and chunky and happy and got a home. But it turned out that she had the diagnosis of sarcoptic mange, and I'll let you guess who else got that same diagnosis. So that was my introduction to zoonotic
Um,
skin conditions many, many years ago. And I think something good for rescuers to think about too is, some of these things can be zoonotic. Wow, there's so many different causes of itchiness. And I think one that I have heard of that I'm curious what you would say about is stress. Is it true that stress can play a role in itchiness?
Yes, stress can contribute to itch, and it can happen in a variety of ways. But we know that stress impacts the body's immune system. And so, if the immune system is impacted, it can then cause an increased risk of experiencing other allergic responses, increased predisposition to ringworm, things like that. And it can contribute to skin issues.
And you mentioned that some animals can actually have multiple causes of itching. Is that right?
Management of all allergies in pets requires a really strong relationship between the medical team and the pet owner, because these things are not curable. They're things that we manage, and it does require sometimes some trial and error and seasonal management. And so there's a lot of relationship and communication that goes into the management. And if a pet does have multiple allergies, then that relationship is tenfold more important, because we might go through the process of doing a diet trial and the family is really strict with the diet trial and we see some improvement but not full improvement. So then the question is, where do we go from there? Do we keep the pet on that diet and implement environmental allergy management, or do we switch the diet to something else that we might think will support the skin barrier in a greater way? That often does become, again, trial and error.
I want to talk about treatment, but before that, I would love to talk a bit more about prevention. Are there things that are just like everyday things people can do at home that can prevent these things from starting?
Great question. For food allergies, that's a little bit more of a tricky question, because that is so based on the pet's immune system. But for environmental allergies and for parasites, yes, there is. So for parasites, we have really great, really safe, well tolerated parasite prevention for cats and dogs. And so I do recommend that pets are on those preventions, just so that we can cover our bases and make sure that they are protected, as well as our homes and the rest of our families. In terms of environmental allergens, there are definitely some things that pet owners can do on a regular basis, to reduce the risk of allergy flare-ups. Those are things like protecting your pet's skin from the environment, not bubble wrap like we talked about earlier, but things like wearing booties on their paws can be helpful when they're outside. Then when they come back in, you take off the booty, you can rinse the booty, but their sensitive paw, hasn't come into contact with those allergens. There are also a lot of pet wipes or even just a warm, damp cloth, and take that and to wipe down the skin, in particular the armpits, under the belly, between the legs, those really sensitive areas that often have less fur to protect them. Just wiping off any debris or allergens that can accumulate can be really helpful in reducing a flare up. There are also supplements that can help the skin barrier itself, and things like fish oil can be nice to add into the diet to support a pet's skin barrier and protect them against those flare ups. So, anything with omega 3s and omega 6, those fatty acids, are really good for skin barrier health. They help to produce healthy oils. Anybody who has dry skin or lives in Colorado, like I do, knows the impact that dryness can have on itch. And so anything that adds some extra healthy fat into the diet can really help to keep that skin barrier healthy, keep those oils being produced in a regular way, and can help to protect the skin.
And you mentioned some of the products out there, like the wipes. There's supplements, meal toppers, like oatmeal baths. There's so many different products out there. Is itchiness ever something that you would recommend people try to manage at home with those kind of like over the counter things? And have you ever seen that go wrong? Like somebody trying to just solve this without the help of a vet?
Where I would encourage people to absolutely seek veterinary care is if those over the counter products didn't work to keep your pet comfortable, or if you notice any damage to the surface of the skin, any any
Mm.
any cut, any scrape, any rash, any break to that skin surface creates a lot more risk, and those products, a lot of those products are not meant to be used on broken skin, and that can cause irritation. So if there's ever any damage to the skin itself, any pimples, rashes, then I definitely recommend seeking veterinary care. The other thing is ears. We mentioned that earlier, and ear infections can be really painful, and pets don't always show how uncomfortable they are. So, yes, we do have over the counter ear cleaners, and those can be really helpful to use. But if a pet owner ever has a question about ear irritation or ear infection, I strongly recommend coming in to seek veterinary care so that we can identify if it is the early stages of an infection and get treatment started quickly so that your pet isn't uncomfortable.
Yeah, I want to talk about kind of the diagnostic process, but before we do that, I do want to ask about baths because that's something that I started doing for my dog a little bit more frequently once we understood that these trees around us are impacting her. We started bathing her more, and I feel like that has helped. Is bathing something that you recommend? And then how do you know like what product to use, how often to bathe them? What's a good protocol?
Oh, such great questions. And I think that we could probably bathe our pets more frequently than a lot of people do. Sometimes people will come to me and they say, "Oh, oh yes, I bathe her. I bathe her once every 4 months and she's itchy."
Mm.
I think, yes, well, if I didn't wash my hair for 4 months, I'd probably be itchy too. So, of course, we don't want to bathe them every day, but bathing every 10 to 14 days can be a really reasonable bathing frequency for pets that have skin issues. If your pet doesn't have any issues, I wouldn't start bathing them that frequently just for the sake of it. But for pets that do have skin irritation, again, not broken, irritated, or scratched skin, but just the itchy, then bathing again, every 10 to 14 days can be a way to help keep their skin healthy. In terms of products, again, we have over the counter oatmeal based sensitive skin products, and I think those are a good option. If those don't work, or if you have concerns about something more serious, as veterinarians, we have more antibacterial shampoos, antifungal shampoos that can penetrate a little bit deeper into some of those issues. But there are some really nice, gentle cleansing shampoos that can help. The other thing that I think is really helpful in between the baths are leave on conditioning products. I
Hmm.
only have a kitty right now, but even if I did have a dog, I, wouldn't want to be bathing him super regularly, especially for our big pets. I know that that can be an ordeal in itself. So I love the leave on conditioning products. There's mousses, there's sprays, they smell good. It can really be a nice bonding experience with your pet, massaging their fur and checking them all over for lumps and bumps and giving them a belly rub. Then they smell good to come cuddle with you, and it can be a really nice way to protect the skin in between the bathing without stripping too much of the body's natural oils.
Okay. So let's say that a person has tried all these things, their cat or dog is still really uncomfortable, and they make that appointment with you. They come in. What do you do? Like, where do you start trying to investigate? Because I imagine that this feels like detective work with so many options for what the cause could be. Where do you start?
When did it start? Is it seasonal? What age did it start? How long have you had your pet? Do you notice it's worse after they come in from being outside? Is it in certain parts of the body? How often do you bathe them? What products do you use? How often do you wash their beds? Just a lot of questions, and probably some questions that people don't understand why I'm asking. Sometimes I'll ask, do they scoot their bum? Do they seem to be irritated at their back end? Do they lick their paws? And sometimes I can tell pet owners are thinking, why are you asking me these questions? But I promise it does all have a purpose. Like you said, it's detective work, and picking out these pieces and putting the puzzles together, that starts our investigation into allergies, is really a thorough history.
Wow. Yeah, that is interesting. You're saying that, and I'm going, why is she asking about scooting bum and licking paws? What are the reasons for that?
Food allergies in particular, the big three, I think of feet, ears, and their rear. So, licking of the feet, chronic recurring ear infections, and anal gland issues, scooting, or more frequent bowel movements can be things that lead me in the direction of food allergies in dogs.
Wow, that's very interesting. Okay, and then I know that there are some diagnostic tools that I've seen used, like a skin scrape or like even sending out a sample to a lab. What are you looking for on those, and what are the different things that somebody might have as an option for diagnostics when they come into the vet?
Yeah, great question. Whenever there's a concern in the ears, we're always going to do an ear swab because we want to know, is there bacteria there? If so, what type of bacteria? Is there yeast there? Are there white blood cells? That's really important for treating ear infections. And then on the skin, it does depend a little bit how it presents. If there is a really like a sort of a seeping wound, then we can collect that discharge. Again, look at it under the microscope. We're looking for, is there bacteria? Is there yeast? Is there a combination of both? When we do skin scrapings, that's us looking for parasites.
So I wonder if you can share a bit about some of the options that people might be given, whether it's like injectable medications, oral. I don't know if there are topical things that might be recommended. What's
Yeah, great question. And there are a lot of different products out there. And one of the reasons that there are a lot of different products is because not one specific thing is going to work for every pet. So the fact that there are so many products out there should be a good reminder to pet parents that there are so many causes of itch and allergies that we have to try different things. And I tell people there's not a magic pill. Although some pet owners who have started that daily pill might argue with me that it is a magic pill because it's brought their pet so much relief, but it's not going to work perfectly for every single pet. So yes, there are monthly injections, there are pills, and there are different types of pills that pets can take. And the choice for those pills really depends on a pet's medical history, results of previous testing, and a conversation with the pet owner. And then, yes, there are topicals, especially when pets have flare-ups that are just located in one area. I'm thinking of our sweet little French bulldogs with their bellies so close to the ground, and they get red on their belly and on their inner thighs. Then we might be able to reach for a topical spray, something to focus in that area without having to do systemic medication to spare some of those side effects and really focus in on the area of concern.
So we have a segment called Tales from the Clinic, and I would love to hear a story from you about a time that an itchy animal came to you and you were able to help them and see an outcome that stuck with you.
Absolutely. So there is a case that stuck with me, and this really reminded me about going back to the basics and starting from the beginning. And I often see pets that have had allergies, have gone through different problems, and when they come to see me, I say, "Hey, we are going to start from the beginning. And I know that you've been through some of these things already, but this is what we've got to do." So there was a beautiful big Saint Bernard named Lily at one of my clinics, and she was a big girl. She had a lot of hair. She had a lot of personality. And she was really itchy. And the owners had tried different shampoos and the monthly injections and the pills and all sorts of stuff, and we weren't getting the results that we needed. And I said, "Hey, I'm so glad you're here to see me. We're going to take it back to step one." And we did the skin scrape, and Lily actually had sarcoptic mites.
Oh,
And we were able to get her treated, and that was curable. And that was just an
that's
amazing opportunity to be able again to go back to the basics, to take it one step at a time, and to never jump ahead or try to make things more complicated than they need to be. We're trying to put the pieces of the puzzle together, but we were able to get her comfortable. And for such a big dog with that much hair and that much personality, it was a really great outcome to get her feeling comfortable.
Dr. Tova, this has been such an interesting conversation, and I've learned a lot. I'm wondering if there's one takeaway that you hope people will leave with today. What is it?
Absolutely. I have also had a great time, and allergies are unfortunately fairly common in our pets. And so I love being able to have this conversation. What I would really want people to know is that there are many causes of allergies. It's not something we can cure. It can be frustrating to work through. And so it's really important to find a veterinarian and a medical team that you feel comfortable working with, being able to have those open conversations, ask questions, and really partner with your medical team. Because again, it's something that does take time to work through and requires trust. I often say that we might know the medicine, but pet owners know their pets. And that is so important when we are partnering together. And it is a partnership with the focus on making the pet as comfortable as possible.
That's it for today's episode. Huge thanks to Dr. Tova for sharing her wisdom. Remember, itchy skin isn't just a nuisance, it can be a sign that something is off and needs to be addressed. Staying on top of prevention through good nutrition, parasite protection, and regular vet visits really makes all the difference. I'm Hannah Shaw. Thanks so much for listening. If you're looking for more animal care tips, check out our past episodes on Spotify, Apple Podcasts, or wherever you like to listen. Now, go give your cat or dog an extra scratch on the belly, hopefully the good kind.